Healthcare professionals, what is a telltale sign a patient has used drugs heavily in their life? 60-year man who had done some drugs in life but was a heavy alcoholic. Never tells doctors of his past. Quit all by age 50. Health is falling apart by age 60. Doctor does an MRI and showing him pictures explaining the results. She turned to him and asked if he had drank heavy for years. He glares at me thinking I tattled. No. Doctor shows him the extra space in his skull around his brain. Explaining his brain had shrunk from alcohol abuse. I guess you can lie about it, but can't hide it. I remember doing phlebotomy rotations at a hospital in the middle of nowhere, Tennessee. Aside from the small 60-bed hospital, there was nothing but farmland for miles. I met a patient with heavily scarred, twisted veins. I failed to hit a couple times but eventually found a viable one. For users can be tough sticks, but what makes me remember him to this day is the forlorn look in his eyes when he softly asked me to be careful because it was his last good one, so please don't blow it. Big ass hole in the nasal septum with no other explanation for cause. Talc retinopathy. Tiny talc particles accumulate in the retinal blood vessels of 4 drug users and can be seen during a routine eye exam. He was smacking his mouth like a fish out of water, wearing a leather jacket in the middle of a hot Texas July. Admitted to coming down after smoking meth. He can hit his veins better than you. When you give them 6 milligrams of Versed and 300 micrograms of fentanyl and they are still talking to you like normal. It's damn hard to get info in them in our usual go-to places due to scarring of the veins. They usually tell us where we have to go because that's the only place that still works. 1 young patient with no teeth. 2 they know very well the dosage of controlled drugs, sometimes even better than you. 3 if they trust you, they will tell you when asked. If they are in recovery, they will often use a lot of sugar and caffeine. If currently using, they'll spend a lot of time in the bathroom. Work in anesthesia, they require 5x the meds to go sleep. I had a patient once refuse the contrast dye injection as part of an MRI scan because you don't know what's in that stuff. They were there because they were having palpitations following cocaine use. They look 10-20 years older than their stated age. You can tell by the way that they are. The surprising ones are the closeted grandpas. I worked in the cath lab and an older lady's cath was negative and the doctor told her, "Then what caused me to have chest pain?" "Probably your habit." "What do you mean?" "The heroin." "Oh. Really?" She looked like your average quilting champion. When they are 25-30 years old and look 50. Substance abuse treatment nurse here. There are the obvious signs to when someone has or is using, but I personally think about 80 of heavy drug users look like everyday normal people. These people wouldn't turn my head at the store or out on the streets. These people have jobs, have families, have lives outside of drug use. A lot of them have emotional and mental challenges that surpass any physical sign of drug use. I did residency in Phoenix, Arizona. One of our nurses frequently referred to the tooth-to-tattoo ratio as a predictor of the amount of methamphetamine use. There was a consistent inverse ratio. It's usually in their charts, but if it's not, Hep C, liver failure, pancreatitis and overall health status and appearance for their age is usually a good giveaway. 10-10 pain score, every time you ask. Some erratic behavior is common too. I see a lot of CKD and diabetes in chronic users or patients in recovery after a lifetime of substance abuse. I come from an area with a lot of heroin, coke and alcohol abuse. I've rarely ever had a meth addict and rarely crack users, so this applies mainly to those drugs. The nasal septum is gone. Either tons of nose spray or white powder. They tell you, "I use drugs." Never forget a patient's history is an important tool. When you tell patient, doctor ordered morphine and they tell you only Dilaudid works. Impatience, mood swings, shakiness, many more. Really depends on the substance, though drugs is an umbrella term for practicality, not for physical chemical similarity. Weed abuse, alcohol abuse, meth abuse, all very, very different. Put individuality on top of it and it gets harder and harder to make a judgment. I think it's interesting to see the playing field with addiction amongst classes. Soccer mom hooked on her kids' Adderall, low-income mom does meth, for the same effect as the soccer mom taking Adderall. Because of the class differential, the low-income mom is labeled a junkie. I hope I worded that correctly. I'm 3 days sober from alcohol, not long I know, and about to kick smoking cigarettes. 3 weeks off chronic weed use. These comments are nightmare fuel to stay sober. Thanks for the wake-up call. Scary stuff. Addiction knows no bounds. I work as an addiction counselor in medication-assisted treatment, methadone, Suboxone, and my clients range from homeless, barely 8th grade educated people to former doctors. That said, addicts are highly impulsive, manipulative, and typically aren't the most forward-thinking people due to the nature of addiction. Pill poppers when they need medications for actual painful circumstances. They don't work or require high doses. To the point where there is nothing you can do, pain tolerance very low, and medication doesn't help but to watch them sit there in pain. Honestly, I feel like most of them are pretty upfront about it. Jaw movement. Before anything else, the loss of control of their lower jaw is a huge red flag of long drug usage. 25 going on 70. When you live fast, you tend to not leave a very pretty corpse. Most of what is telling from just looking at someone can just as easily be caused by other things. Scaring, rapid aging, lost teeth, etc. can all be side effects of chronic illness and poverty. The lifestyle is what makes this worse. Wealthy drug addicts are not as obvious. For example, I know a rich lady who starts her day at 8 a.m. with wine and coke. You can't tell at all when she is sober that she is wasted most of the time. True story. I was starting an 4 on a patient and put the tourniquet around their arm. They chuckled and said, "That isn't even close to being tight enough," and proceeded to put one end in their mouth to tie it tighter. This thread makes me sad. They are really bad to sedate, show strange behavior at some earlier or later point of their stay withdrawal. They possibly show more obvious signs of withdrawal. They don't really like it when they get antagonized. They might try and steal meds. They mostly know perfectly fine where and how to get and for started with them. ICU nurse speaking. As a fairly heavy weed smoke, I'm interested in hearing about telltale signs of that side too, compared to just hard drugs, if anyone can pitch in. Infective endocarditis, vegetation on the heart valves. The patient needs a lot more anesthesia than the average person. They ask on Reddit what the telltale signs are. Some of the ones I remembered during my rotations residency are the obvious track marks, vein abscess, terribly scarred veins, talc retinopathy, terrible teeth, skin, and history of sexual abuse. Or they will just tell you as part of their relevant medical history. Everyone is talking about people who abuse opiates or alcohol. I want to hear from the healthcare professionals who can identify the people who heavily used LSD and MDMA their whole life. LOL. Based on the interactions I've had with literally every doctor for the last 20 years, even mentioning chronic pain will make any doctor suspicious of everything you can and assume you're just there to seek drugs. For most scans of the brain, i.e. MRI, there is noticeably less brain matter. About 2 seconds of looking at a scan of a brain, it's easy to tell if someone is a heavy user of certain drugs, i.e. cocaine, from the small gaps and spacing amongst the brain. Certain vitamin deficiencies. Folate is one example. With even breads and cereals fortified with micronutrients today, it's incredibly difficult to have critically low levels. Heavy alcohol users who essentially drink all their calories develop it though. One time I was having trouble starting and 4 on a patient, and she said, "If I can do it, you can do it." That answered a few questions right there. I've never done drugs but had a lengthy illness that caused vein scarring from frequent blood draws, and for some reason it takes a lot more of drugs like Verse to get me out of it. Also, when I had my first kid, we found out I don't respond to morphine. This was after a C-section because of 2 failed inductions. My doctor gave me something much stronger for my second child, which he said was for end-of-life care, so I think it might have been fentanyl. Some of us are just very, very lucky. 4-leaf clover. Looks to be in their 40s. I'm 22. The obvious signs are obvious. The less obvious but more insidious signs is a history of emotional or sexual trauma.